My research topic was on acupuncture and mental health, more specifically evaluating the effectiveness of acupuncture in treating anxiety and depression. To start off, I thought I'd go through kind of by definition and like symptoms what exactly anxiety and depression is / means. So by definition, depression or major depressive disorder is a common and serious mental health disorder characterized by a persistent low mood and loss of interest or pleasure in activities that significantly impact someone's day-to-day life. And then generalized anxiety disorder involves persistent and excessive worry that interferes with daily activities. This ongoing worry and tension can also be accompanied by physical symptoms such as restlessness, feeling on edge, easily fatigued, difficulty concentrating, muscle tension, and even sleeping problems. Okay, so abstract. My objective of this research was to examine current studies to assess the effectiveness of acupuncture in treating disorders such as anxiety and depression. The design used was database searches for current evidence, including meta-analyses, case studies, randomized controlled trials, along with search engine-based research to determine whether the implication of acupuncture for anxiety and depression disorders has any potential clinical benefits. The outcome of my research suggested that acupuncture shows promising benefits as a potential treatment for depression and anxiety. While some of the studies I found demonstrated positive results, more research is necessary to validate the findings. The quality of studies I used, many had a high risk of bias, but overall, acupuncture could be a very useful addition to standard care. So significance and why I believe this topic is important is because mental health is crucial to our overall well-being. It affects how we think, feel, and behave. Having good mental health allows us to cope with stress, work productively, communicate effectively, and contribute to our communities and relationships, which all leads to a good quality of life. Adding on to that, mental health and physical health are very closely linked. Chronic mental health conditions like depression and anxiety have contributed to physical health issues like heart disease, high blood pressure, and a poor immune system. So in turn, a good mental health can promote better physical health by encouraging somebody being able to have healthy habits and behaviors. Basically, mental health is just as important and should be taken just as seriously as someone's physical health. So, who's affected by mental health? Everybody has a mental health and will face challenges related to their mental well-being, but not everybody will experience a mental illness in their lives. Mental illnesses impact all Canadians at some point, either through their own experiences of a family member, friend, or colleague. Each year, 1 in 5 people in Canada will experience a mental health issue or illness. Mental illnesses affect individuals of all ages, education levels, income brackets, and cultural backgrounds. Around 5.4% of Canadians are affected by MDD, and 4.6% experience generalized anxiety disorders. So what causes mental illness? Mental illnesses are influenced by a combination of genetic, biological, personality, and environmental factors. Traumatic life events like violence can trigger mental health problems or substance abuse if recovery and support for those types of things is lacking in somebody's life. Key factors that support a good mental health or mental well-being include safe housing, education, employment, community support, and healthcare access, which unfortunately not everybody has that access to. And then another part of information I thought was beneficial is the costs related to mental illness. So in 2021, the projected cost of mental illness to Canada's healthcare and social support system was $79.9 billion. Due to underfunded public services and long wait times, many Canadians turn to employer-based benefits or pay out of pocket for private care. Canadians spend about $950 million annually on private psychologists, with roughly 30% paid out of pocket and the rest covered by employee health insurance plans. So this is part of my research. This is a case study I found that I thought was interesting because it included acupuncture points that were prescribed along with tongue and pulse diagnosis. So this case study was conducted through Riley Acupuncture Associates that focused on a 42-year-old woman who was going through a challenging divorce and sought acupuncture to help alleviate her depressive symptoms. Her symptoms included crying all day, feeling of regret, hopelessness, trouble sleeping, fatigue, and lack of motivation to socialize. So her tongue was pink with rough edges and her pulse was thin and wiry. The TCM diagnosis was depression due to liver qi stagnation and spleen qi deficiency, which is a common pattern for depression where stress disrupts digestion and energy flow, leading to that fatigue and emotional distress. Her treatment included the acupuncture points liver 3, spleen 3, stomach 36, liver 14, CV12, LI4, C Shen Kong, GV20, and ear point Shen Men. The study didn't specifically say what kind of follow-up or assessment tool used, but I'm guessing that it was like a self-assessment scale. So after 2 treatments, she said she felt 20% better with more energy and an improved mood. And by the 6th session, she claimed she was 90% improved and almost feeling like herself again. This is another study I found. It's a meta-analysis, and so it examined the effectiveness of acupuncture in treating MDD. It included 29 clinical trials with 2,268 participants. It's sourced from both English and Chinese databases. So the results showed that acupuncture led to significant reductions in depression severity compared to usual care, sham acupuncture, and especially when combined with like the standard antidepressant medication. More acupuncture sessions were linked to greater improvement in the symptoms. However, many trials had a high risk of bias, and the findings from China, where acupuncture treatment frequency is a lot more common and higher, may not apply to other populations. So my conclusion is that through my research of case studies, meta-analyses, and randomized controlled trials, I have concluded that while a lot of evidence explores the potential benefits of acupuncture for depression and anxiety disorders, the overall quality of the data and studies is lacking. So to establish the efficacy of acupuncture as a treatment modality for these conditions, future research should prioritize the implementation of proper follow-up assessments, as well as studies done on more diverse populations, being that most of the research is done in China, where acupuncture as a form of therapy is a lot more popular than here in North America. So that's all from my presentation. Thank you so much for listening.